The purpose of this video is to educate nursing staff on the procedural changes and policy updates when administering blood products. After watching this video, the nursing staff will be able to 1. Recognize the importance of strict adherence to blood transfusion administration policies and procedures. 2. Describe the process of receiving blood products through the pneumatic tube system or by picking up from the blood bank. 3. Perform the 2RN verification process. Sandra Morgan is a 52-year-old female admitted from the emergency department for a GI bleed. She is anxious, pale, diaphoretic, and generalized weakness. Her vital signs are blood pressure 92/55, heart rate 122, respiratory rate 32, and oxygen saturation is 90% on 2 liters of oxygen per nasal cannula. Mrs. Morgan states that she takes naproxen 500 mg twice daily for osteoarthritis in her knee and lower back. She also states that she has been recently treated for a sinus infection and completed a Medrol dose pack yesterday. Her last bowel movement was last night and was black and tarry. Her hemoglobin is 6.8, hematocrit is 19.0, red blood count is 2.8. Her coagulation panel is within normal limits. She was admitted with an order to transfuse 2 units of packed red blood cells with a transfusion rate of 160 cc's per hour as soon as available.
Good morning. Hey, Ms. Morgan, it's your nurse, Allie. The doctor came in earlier. I see you're restless after that. The doctor's ordered a couple of units of packed red blood cells for you today. Your lab work is showing that your blood count has decreased because of that blood that you're losing from your bowels, So, I know you've been having a lot of symptoms like lightheadedness and fatigue. And so getting this blood today is going to help all that feel better.
I'm kind of scared to have blood. Is there any risk involved?
Yes, ma'am, there is. There's the risk of an allergic reaction. These couple of units of blood are going to take several hours to go in today. We're going to monitor you very closely during that time. Some of the symptoms that you might have would be, your lips feel like they might be swelling, or the back of your throat. If you were to feel like you were having any difficulty breathing, certainly if you became chilled or shivering, if you felt like you were getting itchy or saw that you were developing a rash. Later signs might be that your back hurt or your IV site hurt. It could be that you just don't feel right. Any of those sorts of things, you'd want to call the nurse. I'll go over all those again before we get the blood started. But those are some of the risks that could happen, and we're going to monitor you for that. I see you've got your call light. If you were to need a nurse, show me what button you would push to get help. That's right. Yes, ma'am, that's right.
Well, thanks for going over the symptoms for me to look out for. I appreciate that.
Well, I've got your blood consent form if you're agreeable to receiving the blood transfusion.
Yeah, I am. I think I need it. I've just felt so bad lately, and I want to get better. I'm tired of being sick, and I'll make sure to call you if I have any of those symptoms.
Right. All right. Sign right here along the bottom. Okay. And I'm going to witness that signature and date it and time it for now. Okay. All right. I'm going to lay this aside and check your IV site, because before I send for the blood up from the blood bank, I want to be sure that that's working.
The RN should also assess that the IV gauge is appropriate for the patient's vein size and preference. 24 gauge, 20 gauge, or 18 gauge to 14 gauge when rapid transfusion is required. A central venous catheter free of signs and symptoms of infection is also acceptable for blood administration. Verifying order, obtaining consent, and assessing for appropriate IV access should be done before obtaining blood product. Remember that the blood consent is good for the duration of the patient's admission.
The blood return, flush is good. Okay. Thank you, ma'am.
Thanks.
Ms. Morgan, I'm going to check your vital signs now.
Tube the secure send form to the blood bank. When the blood is ready, the blood bank will call the RN with a secure send code. RN receives secure send code from blood bank. Enters code into tube system. Immediately performs verification of product. When a blood product is received via the pneumatic tube system, the RN will compare the blood product to the transfusion form immediately.
All right, Ms. Morgan. That first unit of blood has come up from the blood bank. So I brought a nurse with me, and for your safety, two nurses are going to check certain things about the blood. This is Callie Lee. She's going to help us this morning.
I see that we have an order for 2 units of pat red blood cells for Mrs. Morgan.
Yes, we do.
Have her chart and consent obtained.
She just signed it a little bit ago.
Everything looks good. I'm just going to verify this order for you.
Good. Thank you, Callie Lee.
Hey, Miss Morgan. I'm Callie Lee. I'm an RN here at DCH, and I'm going to verify this blood with Allie, okay? Can you tell me your name and date of birth?
Sandra Morgan, December 25th, 1967.
All right, I have Sandra Morgan.
Sandra Morgan.
D number is D0000594777.
Okay. I have D number 0000594777.
And Moo number is M00005379.
Okay. Moo number is M00005379.
Blood bank number is ZFT 5332.
Okay. Blood bank number is ZFT 5332.
And the patient is O positive and the donor is O positive.
Okay. O positive for the patient, O positive for the donor.
First product number is PCL E0336.
All right. First product number is PCL E0336.
Second product number is W1155172067065.
Okay. Second product number is W115117206765.
And the expiration date is 9/30/17.
Expiration date 9/30/17. Okay. Next one. Ms. Morgan, can you tell me your name and your date of birth?
Sandra Morgan, December 25th, 1967.
Okay. I have Sandra Morgan.
I have Sandra Morgan.
All right. I have D number 00005947.
I have D number D00005947.
I have mood number M00005379.
I have moon number M00005379.
Okay. Blood bank number ZFT5332.
Blood bank number is ZFT5332.
All right. I have O positive on the unit and O positive on the patient.
Patient is O positive and the donor is O positive.
Okay. The first product number is PCL-E0336.
First product number is PCL-E0336.
Second product number is W115117206765.
Second product number is W115172067665.
Expiration date is 9/30/17.
Expiration date is 9/30/17. Everything looks good, and I'll be happy to verify this for you.
All right. Thank you, Galilee.
It is required that each RN have their eyes on every identifier: the blood product, the armbands, and the transfusion form. In addition, each RN should verify the physician's order and that the blood consent has been obtained before co-signing the electronic document record.
Okay, Ms. Morgan, I'm going to scan your armband and scan your blood bank band. Okay, Callie Lee, you'll come over and verify.
I'll verify
A
this for you.
2RN verification reminder has been added to the pre-transfusion
Nice to
checklist.
meet you, Miss Morgan. I hope you get to feeling better.
Morgan, I'm going to get your vital signs.
The pre-transfusion vital signs must be obtained within 30 minutes of starting the blood transfusion. RN should follow the manufacturer's guideline for priming blood administration tubing sets. Be sure to have a bag of normal saline and a traditional IV tubing set at the bedside in the event that the patient has a blood reaction. Once the Y tubing set has been primed with saline and the blood product has been spiked, flush the saline out with blood product until within 1 inch of the exit site on the tubing set. The saline should be flushed into a red bag in case of accidental spillage of the blood product. Now you might ask yourself, why do I have to flush the normal saline out with the blood product if I'm required to prime with normal saline in the first place? The answer is simple. The transfusion start time begins when the blood product reaches the vein. The flushing of the saline helps expedite this process, especially since the RN is required to stay with the patient for the first 15 minutes of the transfusion. Additionally, some patients may be at risk for fluid volume overload such as congestive heart failure or renal failure, and these patients do not need to receive any extra fluid. More than 1 unit of blood product may be infused on a single tubing administration set as long as the tubing set has not been hanging for longer than 4 hours. Once the blood tubing has been properly primed, the RN scrubs the IV with alcohol for 5 seconds using aseptic technique, connects the blood tubing to the patient's IV, and secures the tubing with tape, being sure to tape all connections to prevent dislodgement. Label the blood product tubing at the distal and proximal end if multiple lines will be used to reduce risk of misconnection. The RN begins the transfusion at 2 milliliters per minute or 120 cc's per hour, monitoring closely for blood reaction, and reminds the patient to report any signs and symptoms immediately. Since most blood reactions occur during the first 50 milliliters of blood transfused, it is required for the RN to remain at the bedside for the first 15 minutes of the transfusion. Be sure to document patient education in the interdisciplinary education intervention. Vital signs must be obtained in a sequential order during the blood transfusion process. Pre-transfusion vital signs must be obtained within 30 minutes prior to the start of the transfusion to establish a baseline. Vital signs must also be taken 15 minutes after the start of the transfusion, and again 30 minutes after the transfusion start time. It is also required for vital signs to be obtained immediately post-transfusion. At the RN's discretion, vital signs may also be taken as needed during the course of the transfusion. Remember that the blood product must be infused within 4 hours of the issue time. The RN will remove the patient label from the blood product and place it in a shredder. Dispose of the blood tubing sets and empty blood product bags in a red biohazard bag as long as the patient has not had an adverse reaction. If adverse transfusion reaction is suspected, follow the Lippincott procedure for blood and blood product transfusion reaction management. Place blood bag, attach fluids and administration sets with related forms and labels in a biohazard transport bag and return to the blood bank for evaluation of the reaction. Non-TAR units should send the duplicate or yellow copy of the paper transfusion form to the blood bank and place the white copy in the patient's chart regardless of whether the patient has or has not had an adverse reaction. There are some special considerations that an RN must remember. An MD order is required to use a blood warmer or a pressure bag. An MD order is also required if saline is used between units of blood to keep vein open. It is required to label the blood product tubing at the distal and proximal end if multiple IV lines will be used to reduce the risk of misconnection. Preventing infection is always a priority when caring for our patients. Maintaining a closed system during IV infusion therapy is paramount. Notice there are 2 ports on a blood product bag. If the blood bag is spiked with the wrong tubing, do not remove the tubing. Clamp the tubing and place a sterile end cap on the open end. Obtain the correct blood transfusion set and spike the unused port on the blood bag and proceed with the transfusion as demonstrated earlier. Several resources are available for any question or concerns you may have. Always refer to facility policy and procedures. A clinical nurse educator may be reached at extension 7152 between the hours of 8 a.m. to 4:30 p.m. Nurse managers and team leaders are always excellent resources.